from, oh gosh, I can help it. So, my stomach.
Hi Joyce, I'm Dr. Maddie.
Hi, how are you?
I'm
Nice
good,
to
how are
meet
you? So what's going on with you today?
I have problem with my stomach. You know, I always have a history constipation. I have a history of IBS, and I have been seeing providers several times for medication to help me out. But all the meds that I'm taking is not helping me out. So I wanted to see if there's another form of medication that you can recommend me taking.
Well, we have a new medication that we're starting to try.
Okay.
I'm going to go ahead and listen to your stomach.
Okay.
Yeah, your bowel sounds are a little slow. Have you heard of Linzess?
No. Okay, so what is Linzess for?
Linzess is a prescription medication that is used to treat constipation or chronic IBS in people who have had constipation as the main symptom. Linzess, or linaclotide, works by increasing the secretion of chloride and water in the intestines, which can soften stools and stimulate bowel movements. Linzess may improve stool texture and lessen symptoms such as bloating, abdominal pain, and discomfort, straining, and feelings of incomplete bowel movements. This medication may not be used in children younger than 6 years old because of serious side effects.
How do I take Linzess?
Well, first you want to read the medication guide provided by your pharmacist before you start taking Linzess, and each time you get a refill. If you have any questions, ask me, your doctor, or your pharmacist. It comes in a few different doses. You can get 72 micrograms, 145, 290, and you take those by mouth once a day. You want to take this medication on an empty stomach as directed by your doctor, usually once a day, at least 30 minutes before the first meal. Swallow the capsules whole and do not break or chew. The dosage is based on your medical condition and response to treatment. You want to use this medication regularly to get the most benefit from it. To help you remember, take it at the same time every day. Make sure you tell your doctor if your condition does not improve or if it worsens.
So what happens if I miss a dose?
You want to make sure you skip the missed dose and take the next dose at the regular time. Do not double dose.
Okay, that's good to know. Do you have any further information that I should know about the medication?
You need to make sure you take this medication as directed. Keep it in the original bottle. Don't forget, if you miss a dose, omit that one and take it at the next scheduled time. If diarrhea begins in the first 2 weeks of therapy, stop taking the medication and notify your doctor. If severe diarrhea occurs, contact your doctor.
Okay, so I'm still taking the prescription medication that was given to me the last time when I saw you, but I'm still having problem with constipation, and what should I do?
Okay, well that is, of course, one of the side effects is continued constipation. It should get better over time. But in the meantime, have you ever heard of Miralax?
No, really.
Okay, well, Miralax is an over-the-counter medication used to treat constipation. It works by holding water in the stool to soften the stool and increases the number of bowel movements. It is also known as an osmotic type laxative.
How do I take Miralax?
You take this medication by mouth once a day. I would take it in the morning. It comes in a 17-gram packet, and you mix it in 4 to 8 ounces of liquid. You can mix it with your tea, coffee, soda, juice, water. So yeah.
How much does Miralax cost? I'm always about the price.
Miralax is pretty cheap. You can just get it at Walmart or the drugstore. It runs about $8 a bottle at Walmart. So.
Okay. Are there any side effects?
Of course, there's always side effects. A few would be nausea, abdominal cramping, or gas may occur, but you're taking the Gas-X, so that should help you. You want to make sure you notify your doctor if you have any excessive number of bowel movements persistent diarrhea, severe or persistent stomach and abdominal pain, bloody stools, or rectal bleeding. So, if you want to give it a try, you can just go to Walmart and try it.
Okay, I'll give it a try. On my way home, I'll just stop at Walmart and go get the medication.
Right.
Okay,
Sounds good.
thank you so much.
Thanks, Joyce.
Have a nice day.
Irritable bowel syndrome, or IBS, affects millions of Americans across all age groups. IBS can be frustrating, embarrassing, and even painful. Luckily, there are medications available to help treat this condition. We've heard about Linzess. Let's talk about Trulance. Trulance and Linzess are prescription drugs used to treat irritable bowel syndrome and constipation and chronic idiopathic constipation. Both medications are proven to be effective. However, they have different active ingredients, which patients need to consider for allergy purposes.
This is how Trulance works versus Linzess. Trulance and Linzess work in the same way by reducing pain in the abdomen and accelerating bowel movement. The side effects for both medications are diarrhea, abdominal pain, bloating, gas, and the most common side effects of Linzess may include diarrhea, gas, bloating, abdominal pain, swelling, pressure in the abdomen.
Trulance and Linzess are both part of the same drug class, guanylate cyclase C agonist. There are some differences between the two. The Trulance comes in a 3 milligram oral tablet, where the Linzess comes in multiple doses, 72, 145, and 290 microgram oral capsules.
Some benefits of Trulance are that it can be taken with or without food. So if you prefer to take your medication whenever you want without considering food consumption, then Trulance might be better for you. If you're on the other medication or are taking other supplements, then Trulance may also be better for you, as it is less likely to interact with other drugs.
Are Trulance and Linzess covered by insurance? Typically, no. Are they covered by Medicare? No. So Trulance and Linzess are pretty close to the same price. Typically, the Medicare copay is anywhere from $70 to $474. Linzess is around $19 to $482. Trulance and Linzess are pretty close to the same price. Typically, the Medicare copay for Trulance is around $70 to $474, where Linzess is around $19 to $482, although you can join prescription clubs and get them both at a much cheaper price. Are Trulance and Linzess the same? No. Despite belonging to the same drug class, these drugs come in different dosage forms. Trulance is a newer drug that can be taken with or without food. Linzess should be taken on an empty stomach 30 minutes before breakfast. Which is better, Trulance or Linzess? Trulance and Linzess have similar efficiency and safety. However, Linzess may be associated with a higher incidence of diarrhea, bloating, and gas. For this reason, Trulance may be preferred over Linzess.
So, we highly recommend Trulance. Say yes to Trulance.
Now do the Trulance dance.